Number one, the first principle is very, very simple. Airborne precautions. Patients must wear a surgical mask during transport. Okay, if that patient is on airborne precautions, then remember that airborne precautions are instituted if the patient has any condition which can spread through the air, right? So patients must wear surgical mask during transport. If the patient has a condition which needs droplet precaution, then same surgical mask requirements for the patients like the airborne precaution. And what about contact precautions? Remember that contact precautions, we said Mrs. We, right? So, skin stuff. So the staff should wear appropriate PPE during transport. So for airborne precautions and droplet precautions, the patient must also wear surgical mask. During contact precaution transfer, patient who probably has scabies and all that, the staff should wear appropriate PPE. Always make sure that you prioritize minimizing patient movement to reduce the risk of transmission. Always do that. Always bear that in mind. If you don't need to move a patient, don't move that patient, especially if the patient is under isolation precaution. Now, if you are transporting a patient who is on, airborne isolation, what must you do? The patient must wear surgical mask. The patient must wear surgical mask. What about if the patient is on droplet isolation? A mask is required for both the patient and the healthcare provider. A mask is required for both the patient and the healthcare provider. And remember that we said that if the patient is on droplet isolation as well, the healthcare provider must make sure that within 3 feet of the patient, that person is properly covered. Okay. Okay. Now, what about contact isolation? You've got to use gown and gloves for transporting patients with contact precautions. And ensure proper PPE is worn to prevent contamination during movement.